You are most welcome, ladies and gentlemen, to your power behind the voice on Tuesday Night Anatomy with Daniel Okwan. Yes, we are still in the era of anatomy of clinical importance. And my friends, this is today's case study. A 7-month-old infant is brought to the pediatrician with difficulty in breastfeeding and a noticeable restricted movement of the tongue. The mother also indicated to the pediatrician that during breastfeeding of her infant, she experiences pain in her nipple, and also there's that kind of poor latching. So this is the case study we have over here. So the first thing is, based on the information given, what is the most likely diagnosis as far as this infant's clinical presentation is concerned? And my friends, your answer is Ankyloglossia. Simply tongue tie. Okay, so that is Ankyloglossia. So that is the first thing that I need you to understand. Now, the second one is that what are the manifestations? Yes, based on whatever is happening, that is suggestive of this condition. Yes, first of all, we said there's difficulty, of course, suckling. Yes, in the mother's nipple, okay, to cause more ejection of the breast milk. Yes, that's the first thing. At the end of the day, there's that kind of difficulty in doing that. Yes, the tongue movement, there's that kind of restriction. Yes, that is also, the point. And then, of course, although it wasn't indicated, but one thing that will be, yes, evident will be, of course, reduced, body weight of this infant. So per the month, yeah, there's going to be that kind of reduced body weight because at the end of the day, feeding is poor. Okay, that is also one other thing. Now, the other thing is that, yes, by way of articulating, yes, although we don't expect the speech to be, yes, entirely, yes, correct as of that time, but one thing that we realize is that there's going to be poor speech even with time. Yes, as this individual ages, one of the complications that may come arise with it may be poor speech. Yes, no doubt about that, that there will be poor oral hygiene in the future. Yes, possibly, because at the end of the day cannot, yes, tongue movement is so restricted. Yes, cannot change the shape of the tongue. Okay, and can also change the position of the tongue effectively in, of course, the oral cavity. Now the next thing is that what is the anatomical basis for this ankyloglossia that we're talking about? Now, my friends, one thing that we realize is that it's because of something we call lingual frenulum being short. So short and tight, okay, inelastic lingual frenulum is the one which is leading to this, ankyloglossia. The reason is that now normally we expect that, yes, between, of course, the floor, the ventral aspect of the tongue, yes, the inferior aspect of the tongue, and then of course the floor of the mouth, what we see is that during development of the tongue, okay, one thing that we see is that there's going to be a fold which will connect these two areas. By the end of the day, what we expect to happen is that there's supposed to be, a normal programmed cell death, yes, some kind of apoptotic, activity, okay, should take place to cause, removal or digestion of most of these, what do you call it, lingual frenula that we find over there. So my friend, failure for us to digest most of the lingual frenulum, then what is going to happen is that there's going to be that kind of short, tight, lingual frenulum. Okay, so that is one thing that I need you to understand. Well, sometimes even depend on the position. Okay, if the lingual frenulum is supposed to, maybe digestion is supposed to go on all the way, go to the back and all that to digest all these things, and then it fails to do that, okay, maybe digest a portion, but maybe at the level where we have the tip of the tongue, or maybe just a bit posterior to the tip of the tongue, okay, if that place fails to, of course, undergo that digestion, okay, and then it still persists over there, or that's where the insertion happens over there, and the lingual frenulum is there, then it's going to be that kind of problem. So mainly it has to do with the normal apoptotic activity not, taking place very well. Okay, now one thing that we see is that more often we see it in males. Yes, studies have shown that we see it in males about 3 times more in males than in females. Okay, and then on average, if you take the neonates, yes, if you take about 4 up to about 11% of all neonates, okay, what will happen is that they are likely, okay, to suffer from some of these and seen more, of course, in what you call the prematurely delivered, newborns. That is what I need you to understand. So now the next thing is that what will be, the management as far as this, condition is concerned. Yes, mainly one thing that we need to talk about is that, yes, if the individual is a neonate, okay, if we, target it early, then of course, quickly we can perform something we call frenectomy, okay, to remove this kind of lingual, frenulum, okay, we can perform it, and then of course we remove it. Okay, it is no, a lot of blood will not come, so to speak. Okay, but in the case of, let's say the person is let's say 2 years, 3 years, okay, 5 years and all that, and during the neonatal period, okay, it wasn't taken care of, then what will happen is that you have to rather undergo frenuloplasty. And so in frenuloplasty, yes, it's also a surgical procedure. We want to try and, of course, cut this, tight lingual frenulum to ease the movement of the tongue in there, but it's also followed by some kind of repair in that regard. And then, as I said, remember that there's going to be that kind of poor latch, okay? Saying that, yes, the mouth of this neonate may not fully, go around the nipple of the mother. And that's why suckling becomes a problem. And that's why the mother will be experiencing that kind of pain. So it is one thing that we need to, of course, observe some of these things. Yes, by way of observing the oral cavity, okay, through visual inspection. Yes, you can see it, and then of course we make the appropriate what they call consultation to, of course, the health facility. My friends, I'm very grateful for your time this evening. Have a good night, all of you, and may the good Lord richly bless you. Amen.